Hi, it's Jen Gilbert, and as a former medical sales rep and a current wealth advisor to doctors, I've taken a close look at the healthcare reform bill and the probable effects this bill is going to have on your medical practice. Let's suffice it to say, get ready for a lot of changes. First of all, your patient load could swell to an additional 10 to 20%. This is already on top of an incredibly heavy workload I know you're carrying. Now, granted, a heavier workload might not be so bad if your income was going to go up substantially, but looking at this bill, it just doesn't look like they're going to do that for you. And yes, while it is true that Medicaid reimbursements will rise to equal those of Medicare in 2013 and 2014, remember that the Medicare reimbursements are still going to be only 60 to 70% of the actual cost of care to those patients. And there is absolutely no way to know what's truly going to happen with either one of those reimbursements starting after 2014. Now, you add in the private health insurers trying to squeeze every penny of profit because they're not going to be able to deny coverage any longer. You've got a recipe for a huge workload with little to no increase of return. Fortunately, there are ways to protect your wealth even under this healthcare reform. I've become a wealth consultant to primary care physicians because I found a system that allows me to manage and grow my finances from home while still being able to care for my daughter Samantha. Healthcare reform or no healthcare reform, if you act now to start to control and manage your own wealth, I personally believe that you can at the very least equal the success that I'm having right now. As a wealth management consultant, I strongly advise you not to wait for further reforms in hopes that somehow your workload is going to remain the same or go down, or perhaps the reimbursement rates are indeed going to go up. Instead, I advise you to decide to take control of your financial future starting today. And the only way for you to protect your lifestyle that you've earned is to make that commitment that you will manage your own wealth. The healthcare reform, you know what? It's not a catastrophe for primary care physicians, but it's going to be a huge challenge. Take control of your finances now, and I believe that this is a challenge that you will be able to rise above with your retirement and your lifestyle absolutely intact. I invite you to visit me, learn more at my blog. The address is right below, and I look forward to seeing you soon. Take care.